I will bring up the slides.
Hello, everyone. We are very excited to have you all join us today to hear about our newest region that we are forming, our Pacific region. So we are very happy to have you here today. We have all of our training directors for this region that I will turn to here in just a little bit to give you an overview of their sites specifically. But before we do all of that, I wanted to give a brief introduction to the consortium, to some of the team members that we have on the consortium at NPTC, and to give you kind of a high-level overview of how we operate, and then let you hear a little bit more about our teams and about the specific sites. So in our Pacific region, there's a few individuals that will help support this region. So I am the Senior Vice President of Clinical Operations for NPTC. And my role there is to help support the regional training directors to make sure that everything is running smoothly within the regions, and that the training experiences for the interns are consistent with what we would want them to be. And then in this region, we have Dr. Sierra Swing. She is our training director here for the Pacific region. And then we also are joined by Dr. Scanyers, who is our DEI director and helps to support NPTC and the consortium. So Dr. Swing, I will come back to you in just a minute. But Dr. Scanyers, could you spend a few minutes kind of talking about yourself and your role with the consortium?
Sure. Thank you so much for that warm handoff. So I feel like I have one of the best roles in the consortium because I get to meet with literally everyone. I feel like DEI, there's probably not that many areas that it doesn't touch. So I work with people with creating or reviewing policies, interns with creating programming. I get to work with our DEI consultants that we have in each region. So I imagine once we form this region, we'll have a DEI consultant as well. Or because it's so close to our Cascades region, maybe there'll be some shared responsibilities there. But I meet with all of our DEI consultants monthly, and we together form the diversity committee. And so we really help to spearhead the DEI related efforts for the consortium. And we really see this work as being everyone's work. And also, it's kind of one of those things where if there aren't designated people to certain roles, and it could be like, yeah, everybody needs to do it, but who's going to do it? So we really try to galvanize and really make sure that we're looking at the data that we get from interns. I really appreciate how data responsive the consortium is. We ask for information along the process of applying to internship and after you've matched, of course, and we try to use that data to inform the programming efforts that we offer. Some of the other things that have come from those surveys that we've looked at in terms of feedback from interns has been, people asking, well, I want more information or more conversation outside of didactics. And so we created this initiative called the Diversity Dialogues, and we use the topics that interns mentioned that they wanted to talk more about to inform who facilitated those discussions and what are some potential topics that might come up. I actually am leading one this Thursday on race and racism. We recently had one on transgender care, and we have an upcoming one on politics. And so we're really excited to be able to offer these things, and we really try to support interns to have the best training experience possible. We look at you as people who we want to get to know. And so that starts from day one after we know you're interested in us. And then after match, I'm going to send an email that's like, what are days that are significant to you so that we can really get to know you and things that are important to you. And again, try to be as supportive as we can throughout the process of accomplishing internship. Is a really big deal. And Dr. Bauman mentioned, like, because of all of the things, it can be hard to really take this moment in. So I want to congratulate you all for being at this point of your academic journeys. And it would be amazing to get to know you more. I'm going to stick around for just a few more minutes and put my email address in the chat so it's a little bit more accessible. And feel free to reach out to me if you have any questions at all.
Thank you, Dr. Scanyers. Appreciate that, and appreciate, of course, all of your efforts and the DEI committee's efforts. So I want to give just a few kind of high-level talking points overview of the consortium, and then we will jump into each of the individual sites. And at that point, Dr. Swing, I will ask you to maybe speak about yourself, your role as the regional training director, and also, of course, about your site specifically. So giving you an overview of the consortium. So we were originally formed out of a workforce grant in 2003, and that grant was between two sites in our central region, which is in Missouri. The reason for that was, as you all probably experienced, that there are many rural and underserved areas in which it is really hard to recruit psychologists to want to come work and live in these very small rural communities. So following this 3-year grant, it was very clear that this was not just a 3-year need. This is an ongoing need. So we quickly grew from that workforce grant in 2003 to where we are today, recently celebrating our 20th anniversary, which we're super excited about. And here talking to you about our Pacific region, which will be our 5th region that we are developing. So we currently have 4 active regions where interns are placed at, and then our Pacific region will be our newest region here, our 5th region. So we are super excited about that. And the reason for our growth really is because the need is there, the demand is there. There is a huge need for workforce in a lot of these rural and underserved areas. And that is our mission, and our goal is to help provide that support and help train you all as interns over that year in serving those communities that are in need of those services. So we focus on a generalist training model. So when you come to the consortium, you will get that generalist foundational pieces of competence, core competency areas of APA. And in addition to that, depending on the site that you're placed at, you will get that generalist foundational training, and then you may get exposure to a lot of really interesting, unique, and nuanced specialty areas within the field. So we encourage you to ask lots of questions of our sites and find out lots of the opportunities that each of these sites have. But as the consortium as a whole, you will get access, like I said, to all of those core competencies, generalist competency areas. And we provide regular didactic trainings that you attend. So lots of different topics throughout the course of the year to really broaden your understanding, knowledge base, and hopefully opportunities to practice in areas that maybe you haven't had the opportunity to practice in before. So just a few things about us and our history. We are, you will hear us talk about, and a lot of the sites talk about, again, we are invested in that training, and we are all really passionate about training up and coming psychologists in the field. But we are not focused just on that 1 year. We really want to keep you post that 1-year internship and keep you on for postdoc, and then keep you on even further down the road for employment. And so since our inception, we have trained over 600 interns in total. And of those, we have over 200 of those interns that have stayed within an NPTC site, either for a postdoc or for employment and beyond. Many of them are still with our sites now, at least, again, over 200 are still working at one of our NPTC sites. And what we'd love to see is we now have many of our former interns that are training directors for us, that are supervisors for us. I am a former alumni as well, or am an alumni, I guess, a former intern for the consortium as well. So we really like to see that evolution of how our interns come through and then stay in our sites. And we really do support that and want to keep our interns into these sites that we're plugged into. All right, so in this region, the Pacific region, this is, like I said, this is our newest region. We are not yet APA accredited. Of course, part of that process and the accreditation process for APA does require and involve matching and placing 2 interns before we can move forward with any kind of site visit or anything like that. So this would be an unaccredited region initially as we pursue that accreditation. We were founded just this year in 2024, and we currently have 4 positions that will be available, intern positions available at 3 sites across the state. And so with that, we are going to spend some time letting you hear about each of the sites and the unique experiences that there are that they have to offer at each of those sites. And then we will open up for any questions that you have at the end and some open discussion. So first, we will kick off with Pacific Rehabilitation Center. Is that you, Bobby? You might be.
That's me.
There you go. Perfect.
So Pacific Rehabilitation Centers has been around for 40 years, and we work with people with chronic pain that are covered under workers' compensation. Often these are people that are forgotten or have not had a lot of attention, a lot of even medical care. They are people that initially were, they were provided primary care, physical therapy, maybe chiropractic, maybe massage, and then they didn't get better. So they come to us and receive primary care as well as specialized care in for chronic pain. So we have an outpatient clinic. It is a multidisciplinary approach that includes medicine and physical and occupational therapy, vocational counseling, and of course, psychology and behavioral health. We are the people that truly believe that everything's about behavioral health. Our interns have an opportunity to work in this diverse interdisciplinary model. They become a member of our team and work side by side with our clinicians, and then also become members of our treatment team and can work directly with the stakeholders. Our patients are referred to us by vocational counselors and physicians all over the state of Washington. If you consider that 20% of the population in the United States suffers from chronic pain, that means like 1 in 5 people are dealing with chronic pain. What we tell our interns is that this is a specialty, but it also just involves the entire family. So our interns initially work with the patient, but then the family becomes involved as well. What else did I want to tell you? We have done this in the past, got out of psych interns right before COVID. It felt a little overwhelming. Joining this consortium certainly has made things easier. We have 3 clinics. One is in Moses Lake, and that is more central Eastern Washington, and then 2 in Puget Sound, 1 in Everett, and 1 in Puyallup. Right now there's, I think there's 6 psychologists, and we have 2 LMHCA interns. One of the things that's pretty unique about us is that during COVID, we developed a chronic pain program that was delivered entirely via telehealth. And we have taken the best of that and created a hybrid program that allows us to work in other rural communities. I think that's about it. I think that's a good overview.
That's a great overview, Bobby. Thank you very much. And we will, like I said, at the end, we will open it up for any questions. That can be for any and all the sites. It can be for a specific site. And then we also have some general questions that we have been asked or have been submitted to us that we will cover at the end. So, if you want to jump in, obviously, any of you all as training directors can jump in and talk about your sites when we're open for the Q&A section. So. All right, the next site that we have is Sound Psychotherapy and Assessment, and Dr. Swing will be talking about this one. And Dr. Swing, if you don't mind to spend some time, obviously talking about your site, but also in your role as the Regional Training Director, please.
Sure. So as far as my role as the Regional Training Director, I'm obviously very new to this, but I've been involved with the consortium for a long time. I worked at HealthPoint previously. I was there for 11 years. So we kind of helped develop that program at HealthPoint, and it was super fun. It was one of the best parts of the job when I was working at HealthPoint is providing supervision and being as much of a training psychologist as I could. So I worked at HealthPoint kind of right out of graduate school. I worked there, like I said, for 11 years. Throughout my time at HealthPoint, I also had a private practice that I did part-time on the side. I established Sound Psychotherapy and Assessment in 2008. and it was a part-time thing that I did because I still wanted to do traditional psychotherapy and I wanted to do evaluations, which were things that we weren't doing at that time at Health Point. And then as I was training different up and coming psychologists at Health Point, some of them expressed interest as well. So I transitioned my kind of solo practice into a group practice and started hiring some of the interns at Health Point on the side to do evaluations and traditional therapy if that was something that they were interested in. And so that continued to until I left Health Point in 2020, went into private practice full time, and really wanted to continue a similar mission as Health Point, but in a private practice setting and being able to provide services that we weren't able to provide at Health Point more comprehensively. And so it was bad timing on my part because it was the start of COVID, but it worked out fine. And there was a lot of patients from Health Point that actually followed me into my private practice. And there were several previous interns, alumni of the consortium that joined my practice at various points and completed training that no one else was necessarily providing at that time, especially during COVID. We were still offering in-person evaluations and therapy for people that were feeling really isolated throughout those years during COVID. So I felt like that was incredibly meaningful. Dr. Samuel Collier is another alumni. I don't know if he's still on here or not, but he was logged in earlier. He joined my practice as well and was a great addition. He had done his internship and his postdoc at Health Point through the consortium and has since started his own practice. And so I feel like that's the training that I received as an intern, creating your own practice. And then, something that I definitely support for the people that have joined me previously. And a lot of people have come and gone to their own postdocs and things like that. So at that point, it felt like it was going to be really helpful for me to join the consortium because I wanted to continue to train interns and hopefully be able to provide, long-term employment for people that were going through the consortium and didn't want to continue to lose interns that had previously worked for my practice to other consortium sites. So I figured I should join and continue this great work that I feel like is incredibly important. So at our site, we do a blend of traditional psychotherapy and assessments. Our practice is one of the only 7 providers in Western Washington that are contracted with Child Protective Services and provide evaluations for parents who have had their children removed from their care. And this is an incredibly important aspect of the work that we do. I find it to be, it provides a lot of diverse opportunities for evaluation services to a wide range of clients. And I think that it's been really helpful it's provided meaningful work for, to be able to provide these evaluations for this population, because there's so much need and so few providers that offer this. So I'm hoping to kind of pay it forward and continue to train future psychologists to do this work because I think it's incredibly important. There are lots of other contracts that we have with the state. We're contracted with the Department of Disability Determination Services. So for people who are applying for disability, we contract with them to provide comprehensive or even just diagnostic evaluations so they can help make informed decisions about whether or not someone should qualify for disability. We also have contracts with the Office of Public Defense and get lots of referrals from the Washington State Attorney General and other attorneys in the area, just based on the work that we have done with Child Protective Services and the Department of Children, Youth, and Families. We also have several referrals from psychiatrists and psychiatric nurse practitioners in the area for not only therapeutic services and psychotherapy, but also for comprehensive diagnostic evaluations for ADHD, for learning disorders, for autism spectrum disorder. So we kind of provide it all. Our goal is really to meet the client where they are and help them in whatever way that we can, whether that's through evaluations or therapy. We take a trauma-informed care approach. And, I think that there's been a lot of providers that have, in private practice anyway, who have stopped accepting insurance and are just being a cash-only practice. And so I think that it's important as far as like ethics and diversity to be able to provide services to as many people as possible. And so that's definitely something that we do. We have contracts with Medicaid, with Medicare, and we're contracted with all of the insurances for the big companies in the area. And so we try and see everyone and reduce as many barriers as we can in terms of being able to have people in Western Washington, in the Seattle area, be able to access services. I think that is mostly it.
Thank you, Dr. Swain. Appreciate the
Sure.
overview. Okay, next we have Yakima Valley Family Farm Workers, and this one is going to be a little unique, but Dr. Holly, can you talk a little bit about that generalist training model that you have for farm workers?
Yeah, I think, Dr. Swain kind of talked about this too, and I feel like this is such a cool region kind of being developed here in kind of the connection points to NPTC. And so my name is Dr. Filippoli. I'm a clinical psychologist, and I'm actually also the director of our primary care behavioral health program with the Yakima Valley Farm Workers Clinics. And in our development of that training program, we are a large community health center, some FQHCs in Washington State and Oregon. We also have a specialty behavioral health service. And as we have continued to kind of develop a robust primary care system, that also reveals a lot of those folks who do need higher levels of care. And so our specialty behavioral health is right now kind of more concentrated within Yakima County and the city of Yakima. And so really one of the things that we want to kind of make sure is as we continue to expand care for our population is we're also really looking to expand kind of that full spectrum of behavioral health. And so the new region here creates a wonderful opportunity for us to really kind of push into outpatient therapy and really kind of looking at bringing in interns to really kind of develop those folks who need a higher level of care. And so our system is really kind of focused around outpatient as well as psychiatric services. We do have some wraparound services for patients as well. And I do want to kind of pass things over a little bit here to Dr. Maxson. We also have Brian Hatcher, our Vice President of Behavioral Health, on here. And I'll let Dr. Maxson talk a little bit about what his work looks like, because that is so much kind of matching what our intern experiences are really going to look like here. But really the big piece for us is we provide care to underserved populations. It's a high percentage of Medicaid patients in Yakima, and also for Spanish-speaking patients kind of in the area. As you can tell from our name, a lot of deep roots in the agricultural community, and a big part of where our organization started in providing care for literally people working in the fields. Now we see that the agricultural community branches out to so much more than just our field workers. But even those in Yakima, not uncommon for people to be part of transportation supply lines that get food from the fields to your tables, warehouses, and so many of those things that are a part of it too. And so I think Brian maybe can kind of chime in just a little bit about our VHS services, and then Dr. Maxson can talk about kind of what his work looks like. And that's going to kind of most closely match how we're going to bring in an intern and really kind of continue to provide more of that outpatient work for our population.
Can you hear me?
We can hear you, Brian.
Yeah.
Yep, you're good.
Okay. My mic works half the time, so apologies for that. Yeah, we love the fact that we have a full sort of cycle, if you will, of behavioral health services for patients. beginning in our primary care services over to outpatient specialty behavioral health, including psychiatry, psychotherapy, SUD, and then other specialty services. The beauty of that for me is when they complete a round of outpatient behavioral health services, we don't lose touch with them. We don't just discharge them to the community. They stay in our system as a primary care person. So if they need to come back to us, it just makes it that much easier. Dr. Maxon, I'll let you speak to the work you'll be doing.
Oh, yeah, sorry. I'm Dr. James Maxon, and so I'm the kind of outpatient psychologist and clinical supervisor here. And so for me, my role is generally providing, outpatient therapy for individuals, families. We primarily in the past, we were working with children, but we've expanded our reach to adults too. So we're kind of open to seeing all age groups. We also run a lot of group therapy sessions, and we do a lot of family work. So most of the individuals here have been trained in CBT plus, as well as other specialties, including EMDR, TFCBT, some eating disorder specialties. And we're trying to constantly expand kind of our breadth in the community. But yeah, it's more of a traditional kind of therapeutic approach, and we do more of that, but we see so many different people now. So it's really cool. And like Brian was saying, we do have a lot of patients that we've seen their parents, and we see the kids and the whole family through their entire lives. And so a lot of people who've worked here for 20, 30 years, and we've kind of gotten to know our patients. And it's kind of really cool to see the impact that this has on the community here in Yakima. So.
Very good. Thank you all. Okay, so that is a bit of a high level overview that we have from each of our sites. So we want to be able to open it up to any questions that you all might have. So if anyone wants to unmute yourself, ask any questions, and or throw some in the chat, we will take any questions. It can be specific to a site, or it can be general to the Pacific region. And if no one has any questions that come, Mallory is prepared to throw us some questions that we've gotten submitted to us prior to today. So we'll pause for just a second to see if anyone has anything they want to submit, or take yourself off mute. And if not, we will throw to Mallory for some of those questions.
Hi, Angela. My name is Sala. Looking forward to applying this fall, but I just wanted to confirm. I think I heard you say that this region specifically wasn't APA accredited. If you can confirm that, and then are the other regions APA accredited? Thank you.
Yes, the good question. Thank you for clarifying. So this region, our Pacific region, is not yet accredited. We are going through the process, of course, and following the process, which includes submitting all of our information to APA, APEC, and then also, once we match with those first two interns, we will be able to proceed with site visits, which is one of the last steps before accreditation. So as part of that process, we obviously have to follow each of those steps, and one of those is to match students prior to getting approval for a site visit, which would come after that. So we are in, of course, those stages as well. All of our other regions are APA accredited except for our Cyhawks region. And our Cyhawks region right now, we were just approved for our site visit, which I believe is anticipated to occur in the spring of 25, I believe. That is when the site visit for our Cyhawks region is. The other regions, our Cascades region, Great Lakes, and Central region are all currently accredited. And Mallory was kind enough to put some of the accreditation information in the chat. So if you would like to click on that. And I think that also talks about obviously the status, but also kind of the process and the steps that takes to get accredited. So other questions?
If the APA, I guess once it's approved, because you guys have a great success rate, how long is there retroactive like benefits to previous or like initial interns for this region, or like how long does that process typically take?
Thank you. Good questions also. And the answer that we get, and the answer that we will get from APA as well, is it depends. Right now there is a backlog, of course. However, the way that that process works is generally they will backdate accreditation to the site visit. So whenever that site visit occurs, as long as everything goes well and we get approved following that site visit, then that accreditation backdates to when that site visit occurred. So, you know, if it occurs during that training year, accreditation, of course, would backdate to that training year. Yes. We cannot guarantee anything. We cannot make promises, but as long as we are moving through that process in a timely manner and get those site visits scheduled, if that site visit does occur during that training year, APA's processes to backdate accreditation to that point of that site visit. Thank you for that clarification, Dr. Swing. That is helpful to provide. Okay, Mallory, do you want to share some of the questions that we have received?
Yeah, we had a great question in the open house yesterday, and since we have some alumni here today, I put it in the chat just for everyone's reference. For the NPTC alumni who are present today, could you comment on what skills, experiences, and/or qualities really helped you succeed and stand out during your internship year?
I apologize if anyone else is an alumni, and I'm going to jump in to the consortium. I can answer that question generally if anyone else wants to jump in. So I, as I mentioned earlier, am an alumni of the consortium way back, and I can tell you both from my perspective as an intern, but also I will speak to what we see kind of year over year with interns coming in and getting placed in match. What we see as far as some of those traits or aspects that makes a really strong intern and that makes a really strong training year. Most generally, I know people are really worried about, oh, do I have all of the knowledge or all of the skills, or have I done enough evals? Do I have enough hours in these things? And while there are, of course, minimum thresholds and those things are important, to be quite frank with you, that those are not the things that really make an intern a great intern or make that year a super rich and valuable training year. It generally boils down to motivation and willingness to learn. And you know, for myself as an intern and seeing a number of interns come through, it is, you know, having an intern that comes to us and says, I'm just really eager, I want to soak it all up, I want to learn as much as I can, I'd like a lot of experiences. If you are open to learning and growing, that is what this training year is. And that generally produces the most successful, most rich training year, is just being open to all of those experiences and learning things, even if those are things that you've never done before. So that would be my perspective on what it takes to have a really successful year. Anyone else want to chime into that question? Even if you weren't an alumni, you can still speak to that.
I can speak to it a little bit. I'm not an official NPTC alumni, but I feel like I've trained some important humans. David Bauman and Bridget Beachy, who are the kind of training directors and running the consortium, like the part of the consortium in the Cascades region, were both interns of mine. So I take a lot of credit for their success. Just kidding. But as far as what helped them and others be successful, I think it was the willingness to be vulnerable in your own stuff that comes up in the populations that we see, and to learn new things, and just that willingness to challenge yourself to do things that you maybe think that you're not interested in. A lot of people show up on internship thinking that they have the exact direction that they want to go in their career. And I think that as long as you keep an open mind, there are areas of the work that we do out there that you probably haven't even considered yet. And the willingness to engage in those things or step outside of your comfort zone and to provide aspects of care that you maybe don't have training or experience in, or something that you didn't necessarily see yourself doing, I think can go a really long way. I think that that happened with both David and Bridget and several of the other interns who I supervised over the 11 years that I was at Health Point. You know, introducing them to like adverse childhood experiences and the research around those things, and it has become a huge essential part of their practice and the work that they do. And I think that even giving them exposure to doing evaluations, even in the context of working at HealthPoint, really, trying to incorporate as much of the non-traditional care into a behavioral health setting was helpful for them. And so I think that, just being open to doing things that you didn't think that you would want to do was helpful too.
I may add to that a little. Sorry, Dr. Hawley, you go first, and then I will add.
Well, I think one of the pieces I would just add in here is we are so much designed around teaching the skills kind of involved in this psychological work. I think the piece an intern really needs to bring to the table is a passion for that population. And so I think that's just one of those parts of, as you look at this group, kind of really looking at the types of things we do, we've got a wonderful variety of locations and settings and those types of things. And really, I feel like for myself, when I've been a supervisor, when someone comes in and they just say, this is a group of people that I want to help, I want to figure out how to do those types of things, that goes so far. We don't need you to be perfect on day one. And in fact, that's very much expected. We're kind of ready to do training, but we do want people who really are here to help underserved populations in kind of the ways that our groups do.
Absolutely. Love that. And I will piggyback off of both of you, Dr. Swing and Dr. Hawley, in saying that, I mentioned this earlier, that we are a generalist training site. We will provide those foundational pieces in generalist training, and we may push an intern to try some things they haven't done before. So inevitably, we get some interns sometimes who say, I know I do not want to work with children. I just know it. I don't enjoy it. I've had some practicum experiences. No, thank you. And that's okay. Our goal for you over the course of that internship year is to expose you to lots of different populations, and that might include children. But it is to get those foundational pieces and develop that. And inevitably, I hear it almost year over year where an intern will say, I didn't think I wanted to do that. And then I got to have that experience and see what that could be like, and have the support from supervisors and really challenge myself. And I loved it. And so that is what we will do over the course of this year. We want that training to be individual for the intern, specific for their growth areas, the things that they want, and help really advance them in areas, and help to provide some of that training and experiences on things that maybe you're unsure about. So our goal is to really make sure by the end of the year that you have all of those, experiences and activities to become a really well-rounded clinician. And you never know, you might learn that you like something that you didn't know that you liked before getting the chance to do that work. All right, Mallory, any other questions that we could throw to the group?
Yeah, our next question is, are there opportunities for interns to run groups?
So group therapy, can all of you speak to at the site level what opportunities there would be for some groups, group facilitation?
At Pacific, group is twofold. One is teaching classes with patients, as well as group, a psychology group with patients and possibly family members.
Thank you.
I'll let Dr. Maxon maybe speak a little bit more to the groups he's done. It's something I've had a lot of experience. I've most commonly run a chronic pain group, and definitely see just so many of those wonderful benefits. And I know it's something we're kind of looking at, trying to identify what populations, what topics kind of make the most sense. And so certainly would be some opportunities for that. But Dr. Maxon, what have your groups done?
Yeah, we actually do quite a bit of group therapy now, and a wide range. We have some kind of disruptive behavior groups with young kids, ages like I would say 8 to 12. We've also done some teen groups with anxiety and depressive symptoms, and we're currently working on some parenting groups for parents. As well as we have a couple of therapists who do kind of more specific types of specialty groups, such as IFS and DBT. So there's lots of opportunities. It really just kind of, if there's an interest or there's a specific population, we could definitely incorporate that. And we can hopefully use the other therapists as well. So it doesn't, so they can get support in how to run a group and then get the skills. And a lot of them, we have some manualized treatment groups as well that are very formulaic. So it's really easy for kind of interns to come in and know what to do and how to kind of run the group and what to expect. So there's a lot of opportunities for groups here.
Dr. Maxon, you mentioned this, and a lot of our sites do this. So, you know, again, feel free to jump in if you're one of them and can kind of piggyback off of this comment I'm about to make. But you know what, we look at our interns at the beginning, and we sit down and we develop individual learning and training plans, and that is specific to the interns. And we say, what do you want out of this year? What do you want to learn and grow? And so, if let's take that question as an example, if groups are really something you're passionate about, talk to your supervisors, talk to the training director at the site and say, this is something I'm super passionate about. I really would like to do some of this work this year, because a lot of our sites will lean into that with you and say, great, if you want to do some program development, help us get this group off the ground, help us launch a new group. That's a great way for an intern to get involved in some kind of operational or administrative task with some program development, great learning experience, and also be able to still have your hand in those clinical delivery of services with things like group intervention. So we always just really encourage you to bring up those things that you're interested in, have a passion about early on, so that you can work with your sites and supervisors to say, is this something that I could do here, and what might that look like?
Yeah, I think you're right on, and that's the benefit of a site like ours, because we do have both. We have the entire population available, so it's really cool. So people can kind of specialize a little bit or get a little bit more experience in a certain area that maybe they're not comfortable, and we have enough therapists and people here that can support that. And the population is so varied that there's just lots of opportunities. We see so many different clients, and there's just so many different types of patients and issues and things that they were dealing with that we can kind of really focus for people, which is great.
That's great. Yes, thank you.
Yeah, and I would say for our site, I would say for our site too, it's something that I've been waiting to have an intern to kind of restart groups in this setting. I ran several successful groups at Health Point for the years that I was there: depression, maternal support, chronic pain. And I think when people think about private practice settings, they don't necessarily think about group therapy. But I've noticed, just as a practitioner myself, that there's lots of various opportunities to potentially start groups. And I'm hoping that, if an intern does match and they are excited about doing groups, they'll definitely have the opportunity to help develop and start whatever group that they are interested in. I see a lot of need for kind of like social kind of support training, social anxiety groups for people that are maybe on the spectrum, even just depression and anxiety, as well as codependency I've been seeing a lot of lately in the post-COVID world. So I think that there's lots of opportunities at our site as well.
Very good, thank you. All right, maybe time for one more question.
Yeah, I have another question. Do you prefer interns with a particular research background?
So opening that up for the group, does anyone have a strong preference for interns with a heavy research background?
Pacific does not.
Okay, thank you.
I would say that we don't either.
Okay. And I might answer that question in a similar way. And again, any of you feel free to jump in and add on, or talk about your sites. But I might answer that in a similar way than we talked about in one of our other regional open houses. In that, we know that interns are coming to us at different levels in their training, experience, background, and that could also mean different points and stages in their dissertation process. And so, we understand that interns are at different stages in that knowledge and research. We don't emphasize that or say that it has to be a certain number of hours or way as far as a consortium perspective. But again, going back to that conversation we just had about groups, if research is something you're really interested and passionate about, talk with your sites, because there might be an opportunity for you to do some research, to track some data. I think a lot of our sites are doing some screeners. So, is this something we could look at PHQ data and see improvements? And that's something that I think if you were interested in it, that the sites will help support you in a lot of those areas. So please do make sure that you bring those things up. The other thing that we do is we do commit to at least 2 hours a week of journal article review time every week. And so we kind of have that blocked out. That is your protected time, because it is really important. And we want to make sure that that we are all invested in your learning and development. And while we're going to provide supervision, training, clinical activities, we also know that research is a piece of that. And so you will have 2 hours of dedicated journal article review time to use as you need it and as you want it. And that could be to help promote your knowledge about a specific case that you're working on. It could be related to your dissertation, but whatever you need that time to be, that time is available for you and protected for you.
Yeah, and I'll just add for farm workers, I really do think, yeah, you're right, Angela, just kind of leaning into that interest. We do a lot of quality improvement, kind of program development type things. And so really those could be some opportunities to kind of carve out, that time and to kind of lean into something that we're working on, or to kind of bring in an intern's interest. And also to your point of just, I think we want somebody who can really kind of help dig into some of those research articles, kind of pull out relevant information, kind of communicate that to others. So I don't think a particular topic is necessarily viewed as better than others, but we do want somebody who really is also kind of excited about being up to date on the type of work that they're providing and using up-to-date research to kind of inform their clinical practice.
I may say one more thing and then ask a question to you all at the site level on how this looks, and then kind of how interns operate at the site level. But as a going back off of that thought and conversation that we were just having, and again kind of talking about, these are things that I'm really interested and passionate about. Equally, it's important. We find that interns, you're coming to us just fresh out of school, fresh out of academics and practicum, and with that comes a lot of very unique perspectives and knowledge that you're bringing with you at the site level, and some things that maybe you saw and encountered in new research and new new interventions and things that the site may not be as familiar with, and you might be kind of the expert in this topic or expert in this area of research. And so we find that a lot of our sites, our supervisors, we grow as we bring in interns, and they make us better as a site. And as we are training you, it is also mutually beneficial for us, because just that level of knowledge and expertise that the interns are coming in with is very valuable to us. So I might ask you all to talk about how the interns kind of integrate into your teams in that way, and how they're able to use that knowledge, their voices, and advocate. What is kind of the role of the intern in that way? How do they fit among the team in being able to use their knowledge and experiences that they have to this point to be able to help the team and the system continue to grow?
So at
I would say,
Pacific, sorry.
go ahead.
At Pacific, there is a treatment team, and we run panels, and the interns become members of that treatment team and are part of decision making, part of trying to figure out what's going on with a patient. They've done a lot of the assessment. We look at them just as we would any of our other psychologists, and value their opinion, and also want them to be a part of developing the treatment plan for the patients.
Love that. Thank you.
Yeah, and I would say for our site, we haven't had interns yet, and we're looking forward to it. But in my previous experience supervising and having interns when I was working at Health Point, I mean, dating myself a lot, but there were certain aspects and certain treatments that I didn't actually learn about in graduate school, like ACT, which is a little shocking now that it's like a big thing. The interns came in really educating us about the things that they learned about ACT, and it became a huge part of the treatments and the treatment modalities that we provided in that setting. And I've obviously like carried that forward into my private practice. And so I think that there are definitely opportunities, especially for those of us who have been out of school for a million years, it feels like, to be educated by the interns who are learning lots of new and different things that we might not be as aware of because we've been steeped in the work that we are doing. And I think that creates a really awesome opportunity to kind of have the education and training go both ways. I mean, my expectation for an intern, if they were to join our site, is that they're really kind of a mutual, we work together, that we're going to be colleagues. Obviously, there's training that's happening and supervision that's happening, but I think that there are ample opportunities for interns and supervisors to educate each other and really work together to, like, you know, build on their own experiences, learn new experiences, and really become the well-rounded practitioner that they would like to be.
Awesome.
Yeah, I think I would just say for us, within kind of our behavioral health services, you know, we have peers, we have other office staff, we have master's level counselors, we have psychiatry, we have our substance use professionals. And so when an intern comes in, there's kind of this both and kind of situation in which you can really feel like this new person who knows nothing. And also you've done all the coursework for a doctorate in psychology. And so you actually bring in so many valuable pieces. And so sometimes it looks as informal as just kind of a one-off comment to someone who works in reception or somebody who is involved in care, who kind of sees something and has a question about, hey, that patient and their family, like, what is that thing that's kind of going on? And you become somebody who is knowledgeable about those types of things. So sometimes it looks more formal, like a group of people really sitting down and kind of talking through cases. And sometimes it's just really bringing your expertise kind of into the building and really kind of elevating everybody's knowledge. And I think that combination is just such a cool thing, because as an intern, there can be days when you feel like you are the full imposter, and there are other days you just need to remind yourself, and we'll remind you too, you did not make it to this stage by chance. Like, you put in so much work and so many things to really know what you know to get to internship. And that's a valuable thing for us to bring into our groups.
Thank you very much. I could not agree more with all of that, and it is something that when I say that we're passionate about training is an understatement. Each of our sites, each of our training directors are super passionate and invested in that training, and like we mentioned earlier, you know, and you all have highlighted that it's mutually beneficial. It is something that helps us to continue to grow and to continue to serve the areas in which we're serving. So we're very privileged to be in the role of being able to have our hand in training new interns and bringing in new interns. We're very excited about that. So it looks like we have just a few minutes left, and there is kind of one last question that maybe is a good question for us to wrap up with. Mallory has put it in the chat. So the last question is, when interviewing applicants, what is your favorite question to ask that a student might want to be prepared to answer? So do you have any really good interview questions that you rely on every year, and do you want to give our interns a heads up of what those interview questions might look like?
I think it's important that so often interns are coming from another part of the country, and Seattle has its own positives and negatives about newbies coming in. And I think it's just, we would want to know, you know, what do you do when you're not being an intern for us? Do you have a life? Do you know, what are you interested in? Are you a hiker? Are you a skier? what do you do to take care of yourself?
Mhm.
And then there's always me asking, and tell me what your closet looks like. Tell me what your garage looks like. Because that, of course, gives us a little bit more information about them. But
Uh-huh. I love that, and it also reflects just a care and concern and understanding that we are all humans. And so, yes, there's this professional, and Dr. Holly, you said it earlier, you're an intern, and with that comes some feelings of being an imposter and do I know anything, and you're caught up in all of this, and there's a lot going on in this internship year, and you're a human and we want to make sure you're taking care of you, and so I love that question, Bobby, and the consideration of tell us about how you take care of yourselves, and tell us all of the things that that you do and enjoy doing, because all of those things make up the individual sitting with us and the whole human. So Dr. Holly, did you have something as well?
Well, I was just going to add, I think it's important for applicants to know you're interviewing us too. And I think a huge part of that interview process, and one thing we really want to ask about is, as a supervisor, what is the type of thing that that person is going to need to feel supported? Sometimes I even ask people, how am I going to know when you need more help? Because sometimes people are pretty vocal about it. And sometimes people will tell you, well, you won't hear me say anything, but you may notice me be more quiet, or maybe do these other things. And so really trying to jumpstart that supervisor supervisee relationship in a way that we can be really responsive to their needs and kind of cater our year to make sure that it works for people. And I think finding that fit with supervisors and really being willing and being vulnerable to kind of jump into that idea of, I'm this type of person, and for you to help me learn, I think we're going to need to kind of work in this way. It's so great to have that conversation during the interview, and to empower our applicants to also ask us about, how are you going to be as my supervisor?
Yes.
You get to rank us too.
Yes, that's a great point, Dr. Holly. It is, thinking about that interview process as being, it's a mutual process in which we, of course, sites are going to be asking a lot of questions, and it's important to make sure that that relationship is going to be a good relationship that you feel comfortable with, excited about, because that's a huge commitment and a long commitment to say that you're going to be, matching ranking with a site. And so it's important that relationship is there and that you have that understanding of each other for sure. And Dr. Swing, do you want to finish up for us with any final thoughts?
Yeah, I would just say, to answer the other question that I like to answer, I like to ask questions about areas of the field that they are scared of, intimidated by, don't have a lot of experience in, and would also say that I like to ask a lot of questions too about, just similar to Dr. Holly, what he was saying about asking them what they need in order to feel supported and be successful. And beyond that, I'm very excited to be part of the consortium, and I look forward to this region kind of taking off and seeing what we can do.
Thank you. Thank you all for joining today. It's been a great discussion, really helpful to be able to hear more about each of the sites, and we appreciate all the questions, appreciate all the participation, and we are very excited about this new region to be able to more fully kind of support the area that definitely has these needs and these pockets of underserved communities that we can help to support the workforce and development of providers there in those areas. So thank you all for joining, and we wish you all the best of luck. Thank you. Bye-bye.